Health is essential to the growth and sustainability of all nations. Training centers for health professionals must continuously focus on globally relevant health issues as they aim to address the World Health Organization's recommendations towards improvements in global healthcare. As such, institutions of learning must train health workers that can respond to current and future health needs and challenges in society. In particular, improving health equity is a priority worldwide. Equity is the absence of avoidable differences among people, regardless of their social, economical, demographical, or geographical differences. In response to this challenge, the Training for Health Equity Network was created, a consortium of institutions of learning committed to achieving health equity. These 11 institutions are committed to address inequities in global healthcare through transformations in education, research, and services responsive to community priorities. To effectively contribute to global health equity, each school must first recognize and define which communities they serve, with particular reference to underserved populations. Once this has been done, health priorities and social needs of specific communities and regions can be identified, and each school considers itself responsible for addressing these needs. Within this process, schools collaborate with groups affected by their activities, such as communities, health service providers, and local authorities, to understand the needs of each particular health system. By understanding these needs, schools understand the health workforce required to meet the priority health needs of the communities and regions they serve. By tailoring each institution's educators, learners, curriculum, pedagogy, research, and community service to the region's specific needs, a new type of health professional is trained. These new health professionals are better prepared to address and identify health priorities and needs for the communities and regions around them, especially underserved populations. Together, educators and fit-for-purpose graduates focused on improving the health of the communities around them transform the healthcare system, including local health professionals, citizens, and leaders. Graduates from socially accountable schools are also distributed according to the populations and needs of the communities and regions they serve. This allows them to best address health inequities and strengthen the health system. James Cook University in Australia is one of 11 schools around the world that are part of VNET's global consortium. At James Cook University's College of Medicine and Dentistry, students learn through the best available knowledge, not only on campus, but also in community-based learning scenarios, where they will be exposed to health workforce priorities and social needs of the community. JCU's contribution to health equity in Australia has become clear through recent research. By favouring more recruits from outside the big cities and also employing teachers from rural backgrounds, significant improvements in North Queensland's remote healthcare workforce are noticeable. Approximately 60% of JCU's medical graduates up to now have opted for life outside of big cities, where they are needed the most. The result is a positive change, the transformation of health systems to be of better quality, more equitable and cost-effective, as well as more relevant to the health needs of our reference populations.